Welcome to Medical Montana. We're here at Helena ENT visiting with Dr. Pargett. Dr. Pargett, we've talked before about chronic sinusitis and some of the treatments, but sometimes treatments don't work the first time around. What is an individual to do next?
Well, we need to look at other reasons why their sinuses may not be getting better. Allergy is one example. People will typically have watery eyes, itching, sneezing, runny nose, and we want to treat allergy because that could lead to sinus blockage. There also may be issues with how long they've been treated. Often people have been on medications for short periods of time, 10 days to 2 weeks, but they've been having sinus problems for months or years. And so sometimes they need to be on medicine much longer. So we might put someone on medicine for 4 to 6 weeks in order to try and get their sinuses better. And sometimes even that doesn't work, and then we start to look at the internal structure of the nose as a cause for recurrent and chronic sinusitis.
Tell me more about that internal structure of the nose. What sort of problems lead to chronic sinusitis?
Well, sometimes people's noses are a setup for sinus problems. They may have a little nose, or they might have swollen tissue in the nose, or a deviated septum, which is a term for when the wall in the nose is not down the middle. And that deviated septum might narrow the sinus openings, and so a little bit of stuffiness or congestion could go a long way to blocking the sinuses.
And does that case happen if someone's maybe broke their nose, or how does someone end up with a deviated septum or a narrow canal?
Well, they may have been born with a deviated septum, and then over time, congestion and colds could lead to blockage, or they may have injured their nose playing sports or something like that. And now the deviated septum can make it hard to breathe through the nose, and the deviated septum can also push into the sinus areas and narrow the openings, and then when the sinus openings get clogged and swollen, that's when sinusitis sets in.
Okay, and so what is someone to do if they are in that situation?
Well, we'll take a look inside their nose. Sometimes I'll use a specialized telescope after numbing the nose with a spray, and that little telescope will allow me to look at the nose. Is the deviated septum a problem? Is there a polyp in the nose? Is there swelling in the wrong place? And then often we'll ask a patient to get a specialized x-ray called a CAT scan, and then I can review the CAT scan with the patients, and we can see what are the structures in the nose that might be causing problems, causing their sinuses to be blocked.
And just take steps from there.
That's right.
Is it common that people wouldn't see the effectiveness right after one treatment of chronic sinusitis?
Sometimes, yes, and that may be because they haven't been treated long enough. So we may need to treat them multiple times or for an extended period of times, but the CAT scan is often very important.
Thanks, Dr. Pargett.